And we're rolling.
We're rolling. Okay, welcome back to the RL podcast. Today's guest, we have Alex, who is a clinical lead and aesthetic nurse at Skin Bee Medspa. Mm-hmm. You have a fun kind of transition from going to nursing to helping people get rid of their 11s. And if you don't know what that means, we're going to go into it. So tell us a little bit about yourself and how you got to where you are now.
Yeah. So first, thank you for having me on the podcast. I'm so excited.
We're so excited to have you here.
Yes. So my background can be kind of extensive as far as what it took to get me to where I am today. It's a little bit of a long journey, but it started in high school. I was very into, I wanted to be a cosmetologist. Ooh. So I had that, beauty background of I like to be creative, use my hands to, create hairstyles. I started what I called Hair by AQ. AQ is my, maiden last name was a Q. So I started that where I would do hair for weddings and
really?
prom, and I would do my own hair. Yeah. Oh. So I had that creative background.
She's very good at it. I've seen this.
So then after I graduated, I was like, okay, I'm going to major in nursing because I liked science. I was dabbling kind of between business or nursing, but my science background, I was good at it. I like to learn science, so I went the nursing route. And the funny part was the entire time I'm like, I don't think this is for me at all. I liked it in a sense, I liked caring for people, but it just I didn't feel like it was my passion long term.
Do you feel like you found it now?
Yes.
Oh my gosh.
So with that, my mom started doing Botox when I entered college. So I didn't really know what the aesthetic field was other than plastic surgery, right? So then after that, I started to research. I'm like, oh my gosh, you can do this with a nursing degree. And so from then on, I just started researching, just kind of immersing myself in the field. There's no set degree for it. Really, anyone with an RN degree or higher can inject.
Okay, that's what we were kind of talking about earlier, because I remember at one point, I am very squeamish. The med stuff, does not work well with me, but I love all the the aesthetic side of it. And I was wondering, I was like, what is the degree that you need to be able to do injections and to be able to do that sort of thing? So it is an RN degree or higher then.
Yeah.
There's no skipping the boat on this one.
Okay. But you said as well, before we were talking off air, that it's not really the case where you can get a degree in this field.
Right. So you have to, I said, immerse yourself in it. So what that means is you have to follow around, job shadow, get certificates from different companies that offer them NLI certificates. And that's really how you kind of dabble in it. Now, as far as anyone with an RN degree, at a minimum can inject. So you really have to know your injector and their background and really trust them. Because it's your face, right? It's a big deal.
I was going to say, and we're going to get into that for sure. But yeah, so I was going to say, when I met you a few years ago, you were a travel nurse. So you went from travel nurse to now aesthetic nurse is the term, right? And so you said that you've had this kind of background and you've wanted to do all of those things. How, I guess, was that transition for you?
So I worked in the ICU for about 5 years before I really immersed myself in the aesthetic field. But I took a lot of time just learning the ICU world and just human anatomy and all the things. It's very complicated, and I feel like that was a very good baseline because now I can understand my clients' backgrounds, their medical history better with that ICU background.
So that really, was really cool.
The base. And then from then on, one day I was always telling people I wanted to get into the aesthetic field, but didn't know how.
Right.
Because there's, again, no college degree for it. So I just started telling people that was my end goal, was be in the aesthetic field. And then I just built connections, and I started at a med spa through just my desire to wanting to be in the field, and I just learned so much. And then I joined Skin Bee after that, where I really just leveled up in every different way, my knowledge, better client results.
Do you talk to your clients about your medical background at all, or is it just something that you're able to, I think, better analyze your clients and like their needs?
So it definitely comes up every now and then, because I'll have clients ask me like, what's your background? You know, did you just start this? Because I do look young. So I get that a lot.
Well, because I'm like, it could be a huge selling point in a sense, or just like not selling point, but like something to offer comfort for like first timers that are nervous, you know, because like you said, it's your face.
I was gonna say, like how you said, it matters who's doing the injections, and so it's like kind of like what clients are coming in scoping you out a little bit, like trying to figure out. Okay.
Yeah, because anyone, I mean, can stick someone with a needle or put filler in anywhere.
Ooh.
But what's
I'm squeamish about it. The funny thing is, my dad wanted me to be a nurse. He's so off.
Really?
Yeah, that wasn't gonna happen for me.
But what it really comes down to is, do you have that like eye for detail? Like, can you know what the hyaluronic acid that you're injecting is going to do long term for your client so that they get maximum results? There's so much that goes into it. You know, Botox and Botox is an umbrella term. There's a lot of different neuromodulators out there, but it can lift and pull down. So it really just depends on your client's goals and the results that they're wanting.
Do you ever have clients whose like goals you don't necessarily agree with?
Yes. So I'm a very honest injector, which I feel like everyone should be. And so I'm not afraid to tell my client, like, this is what's going to happen if we do this. Yeah. You know, just because you heard it on TikTok doesn't mean it's best for you. Yeah. And so I go over all the risks and benefits to really customize their results.
So have you gotten to points then where you've turned people down for what they've wanted and what they've asked for?
Yeah.
You've had to say no.
Yeah. And it sucks. Yeah. You know, but if I'm giving the why behind, like, you don't need more lip filler, it's going to look unnatural. Yeah. Or I don't treat the 11s without treating your forehead, your frontalis muscle.
Okay. See, that's something that, and this is just like from things I've picked up, like looking into it. I've never like had any Botox and stuff, but the mom I used to nanny for back in the day, she worked for, like she sold Botox and like did like Allergen. So like all that fun, like injectable thing, like all those things. And she had like a model head in her kitchen and it showed like kind of like if you inject here, here's what muscles fall down, here's what come up. And so I remember her telling me things like you said, it's just like if you're going for this, like you can't just do this area because like the rest of the area is untouched. Like that's going to affect the entire. Yeah, it's all connected. And I think I don't think a lot of people know that. I don't think
that's why it's become so creative what you're doing.
Yeah, and I see like a lot of TikToks like, don't go to an injector that will tell you have to inject both areas at the same time. And it's like, well, if you don't, like your other muscle will compensate more and get stronger and look weird. And it'll look like you get Botox. You know, we don't want that. Just like muscles on your body, your face is not different. Like your hamstring and your booty work together, right? So you can run, do the workout or whatever. But with face, like same thing. When you raise your eyebrows or squeeze them in, if you knock out this muscle movement, you're going to be working this muscle more and you're going to have more prominent lines.
See, there you go. Fun little things. What's the biggest concern that clients come in here with in regards to, I guess we can do Botox. We should probably go into a little bit more to like everything that the Medspa offers, because it's not just things for your face, right? Like there's a bunch of other areas that you guys address. I mean, even like where we're sitting right now.
Like, yeah, you guys.
Why don't you go ahead and tell us?
We're actually at the Skin Bee Medspa right now, which you don't usually see us at. We're usually sitting on a couch and at home in our sweatpants, so this is different.
But then I guess in terms of like facial, you know, procedures that you guys offer, then what is the biggest concern that you guys come across with clients?
So with Skin Bee, we take a very holistic approach to anti-aging. Okay. So you age from the inside out. So it's really important.
Amen.
Yes.
Amen to that. Yes. I agree.
To understand like what you put in your body affects your outward appearance. And if I have a client that's like, I want to look as young as possible, you know, we got to start at the basics. Like, do you do IV nutritional therapy? Do you take vitamins at all? Do you have any proper like skincare? Tell me about your skincare regimen. Like from then on, I build like a customized treatment plan with my clients to go after their goals. Now, it's not something that we can complete in one day, or that's not even possible, to be honest. But we really value that because we're all different. Our bodies are all different, and our goals are different, and what we want.
Okay, I have always heard of people getting IV drips like to help a hangover.
Yes.
Not as part of like an like wellness plan to keep up with, because where we're sitting right now is the IV drip area. So the IV bags hang up here and we could sit and get IV bags right now. But like, so that's part of a typical wellness program that you would create for somebody. And how often is that? Like a monthly? Like what would be the recommendation?
So you can do it once a week.
Oh, wow.
So different than like a pill. I know there's like liposomal absorption and all that stuff, which is great. You still need to take vitamins orally. But with IV nutritional therapy, you absorb 100% of whatever's in that bag. So we can customize that to pick up on like your deficits. And usually we can tell your deficits based on like how you're feeling. So if someone's tired, crampy, I'm going to recommend magnesium to help better regulate their sleep. Calcium or for like anti-aging bones, right? Vitamin C for collagen stimulation internally and immunity, like glutathione. I know that's really popular right now. NAD therapy for cellular regeneration.
You just said something really interesting too, that I've only heard like one holistic individual talk about this. Collagen comes from vitamin C in your body, right? Like that's how it like triggers your collagen response. It's not actually eating or drinking collagen, correct?
Yeah, which is a huge myth.
I was going to say, and I've heard you say this stuff too before about like, no, you can't consume your collagen, but can you? Does it absorb topically? Because I've heard no. Okay, because I've heard that one too, and I wasn't sure.
Yeah.
So you have to. So that does come from vitamin C. That's your recommendation about it.
So it depends on the form we're talking about, because collagen is amino acid peptides, right? So you can take peptides. It has to be formulated right. For collagen. And again, I'm not like a nutritionist or even a doctor. I am a nurse, but through my expertise in my field, I do recommend like vitamin C for stimulating collagen internally, because I'll have clients that'll be like, I apply collagen serums and I'm not seeing a result, and I'm like, it's literally nothing. It's like at most hydrating your skin,
like you said, from the inside out.
So with that in mind, do you have a favorite treatment to do for people?
Yeah, so really everything, but I mean that's
good. That's how you know you're in the right place.
Yeah, I would say the first thing I ever tried was laser hair removal.
On yourself or on someone else?
I was gonna say, I know you tried on my fiance before. My fiance came to see her before. Yeah.
So laser hair, because I have very sensitive skin, and every time I would like shave or wax, I would always have an issue, and it was hard for me to like get past that. So I got laser hair, and now like I'm still in the process of getting treatments done, but that was the best money I've ever spent, because I mean, who wants to shave?
Not me.
Yeah,
I have that Eastern European hair and it comes back dark. And I'm like, I eventually just need to just pull the trigger and get laser hair removal, especially in the bikini area and armpits, like things like that, and like everywhere.
Everywhere, just everywhere.
Yeah, laser hair is probably my top, and then neuromodulators.
Okay, I've been told before, I'm not sure by you, that I wouldn't necessarily be a good candidate for it because my hair is so light, I guess.
I think I have mentioned that to you in the past. So if you have blonde, red, gray, white hairs, the current lasers that we have on the market today cannot pick that pigment up and like kill that hair follicle. So any shade of brown.
But I would kill to have blonde hair. I've never seen blonde hair in my life until like you showed me, and I'm like,
Rachel,
and I'm like, wow, this is amazing. Like it's not just because you're blonde that you have blonde hair.
No, I just like have blonde hair. Like that just is my body. Like genetics. Here I am.
I love that.
I don't
like that you can't get hair removal, but like,
thank you.
Sorry,
sad for me. Here we are.
At least you can't see it, right? I mean, as visible as others.
I'm not complaining. Okay, so laser hair removal is your favorite treatment.
Yeah.
To have and
done.
to do. To have done. How about to do?
To do, I would say, that's a hard one. I like Botox.
Yeah.
Now it's simple. I think filler is a little bit more fun, a little bit more artsy.
Is it also because it's like, is it the immediate gratification about it too, or like, or do you have to wait for it to set in?
So yeah, it is immediate because you do know how it's going to look right after, and then you swell. So that
For
brief
filler,
time,
you mean? Okay.
that brief time before like the swelling starts is where you're like, oh my gosh, the client like is obsessed. Neuromodulators take time to really relax the muscle and see that result, but the results, I love neuromodulators because it just makes my clients feel younger, more awake, happier, feel better about themselves.
So what qualifies as neuromodulators then?
Like Botox, Dysport, Jeuveau, Zeman, Daxxify. There's a lot on the market as far as what can be used in the U.S.
Okay. So we've gone back and forth with this, and I feel like we can, it's been a lot in the news too, and like whether, we'll just be upfront, like botulism, right? How do you navigate that, I guess, conversation with clients? And I know Liv's super interested in that whole topic too, because we were eye to eye on Botox, and things shift and ideas shift, and then like what you hear shifts.
I was
and
gonna
so
say, because I think it has a lot to do with what you hear on TikTok, right?
Yeah.
The fear mongering about it. I'll be like, oh, I'm convinced I'm getting it done. Oh God, I can't do it because of this or that. Like when people are riding these waves of these trends, like I guess any commentary on that? Or like what's the truth here?
Yes. So this is a complicated question, but a very good question. And I myself am very natural.
Yeah.
And I like try to eat very clean. I do NAD, all the things, but there's a line that I'm like, okay, like the science is there with neuromodulators. So yes, it does come from botulism, which is found in canned goods. But what it does is it relaxes your muscles. Now, people put in their bodies like red dye number 40, so many different toxins. So you have to, as your own person, make your own decision. To be honest, where you draw the line. Now we've seen the long-term effects. This product, neuromodulators, have been around since like it was founded in 1920. So it's not a new thing. It was originally like created for eye spasms.
Eye spasms.
Different things like that, yeah. For muscles that were spasming. So similar to like bladder, they use it for that. So it's not new necessarily in the last 100 years. It's been around. So it really just comes down to your goals. And with this form of how they've packaged neuromodulators is, knowing your injector, knowing where they source it is very important. Making sure they keep it refrigerated.
Okay.
Mixing it with the right product, like normal saline. It can be mixed with anything, but you really should mix it with normal saline.
Is that something that's like regulated right now, like what it's mixed with?
So that's, again, a complicated question.
Okay.
There's a lot of med spas that kind of do whatever they want.
I was going to say, I think from the outside looking in, the med spa space, because it's so... again, like when we say within the past decade, so new as being so popular, that there's so much to it that is so new, so fast for different regulations to catch up to it. So I guess like I feel like you probably are operating in a lot of gray area. I don't know. So
as far as Missouri and like laws here, they're more lax than other areas in the U.S. So like California has very strict laws versus Missouri. Now again, it just comes down to like your preference. Like, you're eating sugar that is known to like feed cancer. Are you going to stop eating sugar?
Yeah.
Like botulism, how we've controlled it and very specific to where it's not spreading in other muscles, it is very safe. So typically with the right injector who has all the different safety mechanisms in place and knowledge will know like how to dilute it and where to place it so that you get good results and you're not at risk for other issues like going blind or...
I think what's honestly standing out the most to me is that it's not as simple or it's not as black and white as like you just walk in, they have a syringe, they poke your face, you walk out, and now you have Botox. Like there's so many different pieces to the puzzle. Everyone's like a different, they just have a different body code that will react in a way depending on how healthy they are, how much care they put into their overall like longevity. And then also like what you just said, it's like it has to be refrigerated. There's different things you can mix it with. Like I had no idea about any of that. I thought it was just like you walk in, Botox is in a bottle. I know. You get the needle.
Bada bing, bada boom.
Yeah, and then you're out in like 2 minutes. So I'm
It
just
tells
like,
you how much we know. But that's why we're here to ask the question.
Yeah, because this is like super informative.
And so when you talk about it matters where they source it from, I guess what do you mean by that?
So, yeah, this is a good question again, too. So, there are different companies like Galderma and Allergan and Evolus that are reputable sources to get neuromodulators from.
Yeah.
Now, you can search on Google and find different neuromodulators under different brands, or even acting like Dysport online and buy it. And you don't know where it's from, if it's real, what is in it. Like, I've had horror stories of clients come to me with bumps from neuromodulators like Botox. And you should not have bumps weeks after getting it done. It should be the normal saline that you mix it with should be absorbed, and you should have, smoother skin, not bumps. So I think it's really important to know, have a trusted injector that knows where they're getting their supplies from.
Oh my gosh.
And clean needles, like all these gauze, using alcohol to clean the skin are, these all play a role in your results.
Interesting.
There's, I think it's really funny because I'd have to say that majority of men believe that Botox equals pillow face. And I'm like, that's not what, like, I'm just like, you would not know if I got Botox, I swear. If it's done right.
I have friends who definitely not told their husbands.
Yeah.
They've definitely not. They're like, oh, I want him to believe I'm all natural because, like, they want to think that. It's like, whatever.
For all the ladies that, like, want to just take a part of this episode and just have them listen to this one clip, explain to us why Botox does not equal like pillow face. Like how do you come out looking? Like, you know what I mean? Like, set their fear aside and just like clear the air once and for all so that everyone's on the same page.
So, all right, to be honest, my husband is one of those people that believes that you're going to look fake, and that's...
Because guys don't know so much about it. They just don't.
Yes, and him growing up in California, like, it's been around there
a lot of...
for years. Like, everyone's walking around with pillow face, and... Like, our motto here is, like, undetectable injectables. So we want you to go home and your husband not know, or whoever is at home with you, your significant other. Now, with doing neuromodulators, it's not a magic wand. It's just meant to minimize movement and relax that muscle so that the other muscles lift more or they pull down depending on your goals. So you're not in any manner going to look fake if you have the right injector that knows how to place it. And it has like a consultation to discuss your goals too. Okay. Filler or hyaluronic acid injectables, like I like to call it instead of the name filler, that's how you get pillow face. So you really have to know anatomy and then customize that for the specific client so it looks very natural.
I have a question just about like when we talk about how Botox in different places, different muscles that you can inject can either lift or pull down. When you think of aesthetics and a face, you always think lift. So in what areas would it be the goal to actually bring it down?
So it really just depends on, like, I can place it if your eyebrow's too high, lower or closer to the brow so that you get it to drop a little bit more. So for men who are like, I want to have no wrinkles too, like the girls. We would place it lower so that they're not looking super lifted and feminine. We would place it heavier and lower down, closer to the brows, so it's smoother, more natural, so they're not looking like I
feel like
feminine.
It's so important what you just said about looking too feminine or masculine in a type of a way because like that is part of the creativity where you have to trust your injector and they kind of like need to know your goals or need to know what you're into almost because it could be different people's goals regardless of gender to look more feminine or masculine. That's just so interesting. And we do more like off-label neuromodulators. So what that means is typically on-label, what you'll learn from the
companies like Allergan, they'll inject like 11s, forehead, eyes, crow's area. Like we will do the nasal area, nasal flaring. We do bunnies. We do lip flips, lip pops. We inject the bottom. We do the chin. We do the corners of your mouth to relax that so you get lift there. We do the jawline to tighten it. Like we do neck. We do hyperhidrosis to like slow down sweating, stop sweating. And you're like armpits, hands, feet. Like there's so many different areas that you can customize.
So when you say off-label, what you mean is like the companies didn't create it for this purpose. It's how you can be creative with the product,
Yes.
I guess. And you're saying that this was something like you had to learn on the job.
So you can do different trainings from other injectors, but as far as like the companies, they only follow usually what's FDA approved. So typically it's upper face where that product's FDA approved, not lower face. So that's all like off label, but I've done like my chin, my DAOs, and that's one of my favorite areas because I'm very expressive, but you can't tell.
I'm very expressive though. You can't tell. So what do you mean? Like the chin lowers your expressive? Wait. I'm very expressive, very happy. So I get my DAOs to relax the corners of my mouth, so I'm not having like heaviness right here. And then the chin is one of my favorites as well because I had a very strong mentalis muscle here. So like I can kind of activate it, but I do have active Javo here, but I can't activate it so you get like that orange peely look. So it helps smooth that out. Okay, it helps smooth it out. And you're saying you get it in the corners of your mouth so it doesn't droop down like when you're being expressive, so it keeps you like...
It's more so at rest. Like rest. I still have movement. Like I can still frown.
Yeah.
You know, my husband doesn't say anything about it, so he doesn't know. He thinks it's more up here.
He's going to watch this episode or else screwed.
But you can still like move those muscles. It's not like totally knocking it out, but it's going to minimize. So at rest, your corners of your mouth are going to be more lifted.
Very interesting. And does that help with anti-aging in the long term? I guess it's something I've noticed.
You gotta ask the question now.
I'm so interested in like people's faces. Like it's always been so interesting to me that like not like two people look the same, of course, unless you're twins. But it's like you can tell when people age that their mouth does naturally downturn. You start to see their bottom teeth more than their upper teeth when they're speaking. And so do those kinds of injections, they help with long-term aging?
Yeah.
Or is that something that you would recommend to somebody who has more mature skin to get?
I was gonna say, I thought you were gonna ask, are preventative Botox legit, or is it like? I want to
hear that
myth,
too, but
or is it
one thing at a time?
Yeah. So over time, your muscles get stronger, so they will get bigger. So you will. Preventative is 100%. Those questions kind of go hand in hand.
Okay.
So with treating this, yes, it doesn't matter how old you are, as long as you have wrinkles at risk or you would like to treat that area. Definitely preventative is a thing. For me, I have really strong 11s, so I treat that area. Now, my forehead naturally doesn't move a lot, but when I do treat the 11s, I do forehead, like I said, and I get crows. I do my masseters, and then the DAO.
I have so many friends who talk about getting their masseters. So for those of you who might not know like what that is, could you explain to the people?
So it's for like if you grind your teeth a lot, it's a treatment, a medical treatment, but it can also be for aesthetic purposes, for slimming the face. So that was my goal with it. I did hold a lot of tension in the masters, but for slimming my face, I have a very round face naturally, so I do get masseter Botox.
Wait, I've seen so many videos of people getting like injections down here in the jaw area. Is that like contradictory to getting like Botox there then to slim it, or like is that specifically for people who like want a more pronounced jawline, or like?
It really depends on the client. So for some clients, I don't treat the masters because when you like make this not as tight back here, it's going to droop forward and give kind of like more, make this more pronounced, more that jowling here. So with masseters, you have to keep that in mind. Like if I treat this and slim this, if it's strong enough, will it, cause them to have heavier jowlings? So then that's that type of client. And then the alternative is if you treat like what they call the Nefertiti lift, is the jawline here and below, that will tighten this area. But you can also do like filler there. I mean, it really just depends on the client's goals.
Doesn't this make you like want to go get a consultation?
Yeah, like, of course. You already know. I'm so behind. So behind.
No, I know, me too. I'm like, okay, hold the freaking front door.
But I'm just like here, like mesmerized, because I'm just like, it is not so simple. Like, it's this affects that. Like,
well, and when you hear
holy
somebody
cow.
talk about it in that way, it just, in the way of like,
makes me feel reassured.
exactly. Like I was gonna say, it makes me feel like you trust the process more because you understand how much goes into it and how much like biology is behind it, and how it's not just show up with a syringe, boop, there you go, you're frozen.
It's not that simple. You know, if that's what you want, then you can get that from some injectors.
Yeah.
But just with me and how I do things, I want you to know the risks and the benefits and like really go after your goals together and talk about it. But going back to your question, more preventative. So this is one of my favorite things to talk about because I'm very passionate about, like, you need to have a good skincare routine down before really going into neuromodulators.
Okay, but what counts as a good skincare routine?
So we have like different like protocols set in place for anti-aging, but really what it comes down to is, are you using a retinol? Are you using SPF? Are you protecting yourself out in the sun? Are you using vitamin C topically? Is it formulated to be effective? And then are you using some sort of acid to exfoliate the skin? That's like the main points and pillars that we have in place. We call it our ABC glow. So the A stands for vitamin C, B for broad spectrum SPF, C for vitamin C, and then glow are glow bee pads.
I think I'm about, well, you know what? I don't actually know. I think I'm maybe about like 75% there, but like there are some things I've just never used before. Like I've never used a retinol before. Sunscreen, the one you gave me, that tinted sunscreen, I use every day as like a foundation.
I'm like, I
have
got it
some
when it
vitamin
comes to
C
sunscreen
that I use at night.
Why do you use it at night?
I don't know. Just less sensitive to the sun.
I'm like, wait, let me ask the expert here.
I heard someone say that, so I use it at night.
I use it AM and PM, so it does help kind of like 10x your SPF because it is an antioxidant, so it fights off free radical damage, so it makes your SPF stronger and more protective. So
I thought that it made you more sensitive to the sun, or am I getting that confused with retinol?
Retinol does. So that's at night.
Okay, that's what I thought. I've
never used retinol.
I don't have retinol either. Okay, we're on the same page. We always are.
Yeah. But I'll have clients come to me and like, I don't want to do skincare. I just want you to do Botox. And I'm like, well, 50% of your results come from skincare at home. So it is very important that you really make the time and invest in yourself and do this at home, AM and PM. It takes a few minutes before investing in all of these treatments.
So I would point that out then as one of those like tips and tricks for picking a good injector. Do they talk to you about skincare?
100%. And that was like the first thing I ever did. And I used to have crazy acne. I mean, I had texture, enlarged pores, blackheads, all the things. And I didn't even realize that if I just, invest in a good skincare routine, like I don't have to live with that. And you get the anti-aging benefits of it.
I am not that hard to convince with this stuff.
No, me neither. I'm like, Alexandra, when am I coming in?
Tell me exactly what I need to do and I'll do it. But I think it really, really speaks to like Skin Bee and what I think they hold you guys, the standards they hold you guys to. Is there something when you started here that like stood out with how they were like training you or like how they treated clients and just like from starting out to like still being here, like what is it about Skin Bee that you, I guess, are passionate or like behind their message with?
Definitely the customized treatment plans are huge because not everything works for every single person. Like you can't necessarily get laser hair in areas you have blonde hair. Ooh. So not everything works for everyone. And so really having that time, we schedule assessments with our first time clients to really dive into that. Their goals, create their treatment plans. They get to go home with it. It's in their chart so we can access that and like really build that foundation of skincare and then their treatment that they're coming in for that day, and then go from there. So that's like number one. And then number two is definitely that Beth, the owner, the CEO, the pride that she has in all of her providers and DOFIs, the front desk, directors of first impressions, employees. We all are super educated to talk about the treatments, no matter if we're doing it or...
Directors of first impressions,
Yes.
That's the cutest freaking acronym ever.
That's-
DOFI. I freaking love that.
That's so well. It's giving. Okay, I was gonna say it's giving Chick-fil-A, but everyone uses Chick-fil-A as an example of like how the heck are they so kind and why are they so nice and like those little things of like my pleasure taking your garbage. I love it. You know, like it's like all those little things that make the biggest difference. And I know that there are so many giant med spas in the area or in the country, and not everyone probably feels as welcomed going there. Not everyone feels like that they're, you know, what they're going to be treated for is personalized. They're just kind of like another number in the door and then out. And so I think it's good to feel like you are genuinely cared for and like seen. And I'm sure you guys get to see the results and have very happy people and people that come back for that. So that's like really important.
Relationships is huge for us here. It's part of our core values of leaders. It's that our relationships. So we really invest or take the time to really get to know our clients and their goals and what they're wanting out of this, and just give them the Skin Be Wow experience so that they're comfortable and they leave happy and not like unhappy.
Yeah.
So is there anyone then, you know, who I guess is a good or not good candidate for Botox?
I would say if you have wrinkles at rest, meaning you look in the mirror, no expressions on your face, and you have fine lines or wrinkles, you are a candidate. Now, prior to that, prior to the age of 25, you don't have collagen loss, so you don't necessarily need to start. I would spend your money on skincare and doing more preventative treatments like microneedling, things like skin pin, CO2 laser, things like that, not necessarily neuromodulators yet. Now, if you're over 25 and you look in the mirror and you see those wrinkles, for me it was my 11s at rest, you are a great candidate to start.
The piece of advice I got from that mom that worked for Allergan, she's like, wait until you're 30 and then you can start. She's like, but don't do it beforehand. She's like, wait till you're 30. And I'm like, I don't know why I have that number in my head, but I'm just like,
That's
okay.
a good number. I feel like it always, like so many times with girlfriends, it was like, okay, when I'm 25. Okay, when I'm 26. No, when I'm 28. On my 28th birthday. Like, that's when I'll start. You know, girls, like, put in their heads these kind of, you know, timelines. And it's like, no, it's not about that. Not about the age. It's about the static lines at rest.
Yes.
I think I just feel that, like, it's something that I'm going to want to keep doing. And so it's
Is
like...
it something you have to keep doing?
Yeah, so when you're doing neuromodulators and you're minimizing that muscle movement, you're going to go right back to aging, and those wrinkles are going to continue to form and get stronger afterwards. So you do need to keep up with it. Now, I recommend every 3 months, but no sooner than 3 months, because then you're at risk for becoming immune to where it won't work.
Right, because I've heard that too, like where like too much exposure. I mean, it's not that it builds up in your system. It is, I guess, kind of like an allergy where then over time you'll react.
So if you're doing it, let's say every 2 months, going in and your injector's letting you do it every 2 months, you are at risk because your body can develop like antibodies so that it doesn't work for you, which is a huge deal right now because Botox, it's FDA approved to last 2 months. So it will last 2 months, you know, if you were super consistent. Now, everyone's bodies are different. So I just want to preface that. But it is FDA approved to last 2 months. So if you're doing it every 2 months, like, you're at risk for becoming immune.
Okay, so picture this. You have a 28-year-old that just had a baby. How soon after would she be able to get Botox again? Does it depend on breastfeeding and stuff?
Yeah, so always talk to your doctor now, because everyone has their different opinions with this, but typically You cannot get it definitely if you're pregnant, but breastfeeding as well. You need to wait until after.
Why is it dangerous if you're pregnant? This is just because I just don't know.
So it is a toxin going into your body, right? So those babies are precious. No one wants to hurt the baby. Now, can it hurt the baby? Not necessarily. It can be safe, but they don't study on pregnant women. So because no one wants to.
I was going to say, because everything you basically can't do when you're a pregnant woman.
Yeah.
But that's why, because you just simply, it hasn't been tested, so we just wouldn't know.
Like similarly to using retinol while you're pregnant. Typically, everyone's like, no, you can't. Like, because the studies show that you can't. But the studies were actually on Accutane. And Accutane is a pill you take.
Oh, yeah.
Yes.
Right.
So it hasn't necessarily been studied that you can or can't use retinol topically while you're pregnant, because no one wants to invest in that and test on a pregnant woman. I surely would not risk my baby for a study.
So your skin usually looks really good when you're pregnant too, so just like ride that train. But like
getting ready.
But then afterwards, it's like you don't have all those hormones in you anymore.
Refresh.
Yeah. Which I guess kind of leads me to my next point. Okay, I'm pregnant. This will be my second kid.
I couldn't tell.
I come to Skin B Medspa, and I basically am like, tell me what you guys recommend for me to feel like my best self. I know you guys have some cool machines too, and I really want to hear about it.
Yeah. So definitely, while you're pregnant, there's not much that we can do other than like skincare that's safe for pregnancy. So that would be more personalized to like you. But as far as body treatments post-pregnancy, I love our body devices, or BTL devices. So they are FDA approved. BTL is the company name. But we have 3 different kinds, and then we have our CO2 laser. So we have our M-Sculpt Neo. We call it the GOAT. It actually is like doing 20,000 crunches in 30 minutes, 25,000
You've tried it on yourself, haven't you?
Yeah. So it targets stubborn fat areas where you want to build that muscle, decrease fat. It also hits visceral fat around the organs too. So for me, my abdomen was something that I just, no matter how much I dieted, exercised, like I just always had a little bit of fat on my stomach. So Neo, our M-Sculpt Neo, helps with that. Our M-Tone is what we call our cherry on top. It's for cellulite or skin tightening. It uses RF therapy for that. So when you see like celebrities with these like airbrushed legs or arms where it's just smooth and you're like, how is that? It wasn't like that before. It's most likely M-Tone.
Huh.
Wow.
And then our Kegel throne is called Emcella.
So Kegel throne, you guys. This is what I've been most interested about.
Yes. So it's like doing 11,200 Kegels in 28 minutes.
Holy shit.
So it's
that'll save
very
you some time.
strong. And to be honest, this is not something that like my clients come in wanting to talk about. But we talk about it here because we're all very passionate about pelvic floor therapy as well as internal health. Means your outward appearance or outward health.
Like if you're sexually active, if you have a kid and you have a vagina, like you got to be on this. This is important because no one wants to be peeing when they sneeze, and everyone wants probably pleasurable sex with your partner. Like it affects all of that area.
Yeah, so I haven't had kids, but I've done the Emcella, and I'm like, I'll try anything once. You don't have to tempt me. But so I've done Emcella, and you do it in a series of 6, and each is about like 28 minutes. But it does help with increasing blood flow, so it helps increase your sex drive.
So that's not the Kegel throne.
That is the Kegel throne.
That is okay.
Yeah.
So how does it work? Because to me, it looks like a chair. Is it something that is like it goes inside, or like what is that? Like,
so it's literally just a chair that you sit on, but you have to position right so that it hits the right muscles. But then it just works your pelvic floor. You just sit there. It's a workout and you feel it, but it really just strengthens that area.
I was going to say, so you said it increases blood flow, increases sex drive.
It helps just tighten there, strengthen the muscles. It also helps prevent like prolapse rectums. So being a nurse in the ICU, I would have clients of all ages. You know, as you age, those muscles weaken down there. So you can't hold in those same organs, similar to like your uterus. You cannot necessarily, as you age, hold that in. So it helps prevent it when you have strong pelvic floors, similar to like the other area, the anus area. So if you're not having a strong muscles back there, it will prolapse and it will fall out.
Okay.
So it's preventative as well as.
So that's really a good thing for, honestly, aging.
Yes.
Wow.
And that's why like we take a full body analysis here.
Right. This isn't just about your face.
Yes, exactly.
And I was going to say, and with that in mind, what I've seen lately across social media as like one of the biggest trends that I don't personally know a bunch about, that I'm hoping you can fill me in on, is NAD therapy.
Yes.
Talk to me about NAD. What is it? What are the benefits? Like, fill us in.
Isn't it like Hollywood's secret right now? NAD.
That's what you see about everything.
Yes, like Hailey Bieber and Kendall
yeah.
Jenner
Yeah.
getting their NAD drips. So we do NAD injections here. So it's one of my favorite things. I started it in November, doing it every single week. So I do
herself,
it.
so she gets NAD therapy.
Yeah, for muscle. I put it in the muscle, but not in the IV bags.
Okay.
So what it does is it feeds NAD to your mitochondria, so it gives your body energy.
What is NAD?
Mitochondria is some powerhouse of the cell.
So it,
Biology from high school.
There you go.
So it literally feeds energy into your cells. So if you don't have NAD, you can't make new cells, right? So your body makes NAD naturally, but as you age, that declines, just like collagen.
Right.
So you need to supplement it. So we do that with IM NAD injections. So for me, I'm 27, almost 28. So I still have like a decent amount of energy, but definitely I notice like it's declining. So me doing NAD, like after work, I can go home, clean my house, and then wake up the next day, do my workout, run my dog, all the things, and feel energized. It's kind of like taking an Adderall, but without taking an Adderall.
And you're able to like go to sleep at night
Yes.
normally?
Yeah. It actually has helped me sleep better and more sound.
I'm gonna like get this for my fiance for his birthday.
Yeah.
Yeah, Hayden would love it.
He would love it, you guys.
My
He just
husband
went.
used to get that for me for my birthday because I'm home with the kids.
Yeah.
That sounds wonderful. And I just would rather not have to rely on caffeine. I don't know. I just don't like caffeine. Like, I'd rather have
Yeah.
something where it's like I wake up and I'm good. Like, I'm ready.
Yeah. And you can like microdose this, so take small
Oh.
amounts, because it can make you feel like overwhelmed with energy, like a little bit anxious, which is totally normal.
Oh, that would be me.
But it lasts
I always
about
have
30
negative
minutes.
effects.
Girl, you have
Everything.
the best energy right off the bat, too.
Yeah.
Yeah.
So I don't know that I should do this NAD. I probably will.
But it only lasts 30 minutes, the anxiety.
Okay.
So
Oh.
it depends on where you inject it. So if you inject it arm, you're going to feel it more up here. And this is just what I've noticed with my clients and myself.
Okay.
But if you do inject it in your booty muscle, which is where I do it, you feel more sluggish in your legs, where you're like you just ran and like you just exerted yourself.
Okay.
But then after like that 30-minute mark, you just feel more energized and you can just get everything done.
Well, I think we're just we're like soaking it in. I'm just like,
I do
wow.
wanna-
Why is this only like a thing now? You know, like, is this like a recent thing, or is it like a recent, I don't know, discovery, or it's just becoming popularized?
Yeah, I think definitely celebrities have known about this for a while, but
Yeah.
it's just more now mainstream.
Is
so
it
the
because it
regular
was like
people-
expensive and now it's a bit more attainable? like
Yeah,
those things?
it's more common, more well known. Now, I did try NAD pills prior to doing injections.
Okay.
I noticed nothing. It's not absorbed the same at all.
Is
Like,
that okay? So like, if somebody was curious about NAD, they possibly could go to like an over-the-counter thing, but you're saying it's just not really effective.
I mean, like, I've done it. I've done like the liposomal NAD.
Right.
I just didn't notice anything, and I did it for a long time. My mom has done it. Like, just from my personal experience,
Yeah.
the absorption is not the same.
as getting it injected, so now you'll do it once a week.
Yeah, I do a double once a week.
Ooh.
Yeah.
That's fancy.
Well, that's really cool. Do you guys offer like facials?
Yes.
At all?
So we do chemical peels. We're not like a frou-frou-y place. So everything that we do is for results.
Okay.
So we do like chemical peels, so high levels of medical grade acids where a trained professional provider will perform the treatment. We do pair it with a dermaplane, so different than something you get at Ulta. It's a medical grade scalpel that gets rid of all the furries, the vellus hair on your face.
That's how I break out. If the couple times I've done it, I definitely Amazoned them, and it was not medical grade. But I'm sure you heard
the story tales all the time.
It just had me break out like crazy. But I know people like rave about it, so I'm like, this is medical grade stuff matters, guys.
And if you're just wanting to like shave your face, the ones at Ulta are great. I'll use them to shave my face. But as far as if you're wanting to really exfoliate the skin, medical grade scalpels, I mean, it's night and day difference.
Really?
Even chemical peels. Have you guys ever tried one?
No, and I really want to. Is
haven't.
that where your whole face like literally peels afterwards?
So it can. There's different levels. We do lunchtime peels, so you won't have like heavy downtime.
Cool.
But you just come in like once a month, and it really just cleans everything off, your face, and stimulates that collagen. But for like the baseline for diminishing fine lines, wrinkles, and improving texture, pore size, hyperpigmentation, chemical peels are where it's at.
Okay.
So
sorry, you go.
Well, I was just 2025 bride over here. Is that what I should be looking at, like for wedding prep coming up? Everyone always wants to know what's the beauty hack, what do I need to be doing to prep to be my best self for my wedding. You always hear brides talk about that. I guess what would be, your recommendations for bridal era?
Yeah, definitely trying it a couple months before for sure. But for weddings, oh my gosh. And I was a 2023 bride, so I did everything, that I could, except I didn't do neuromodulators at that time yet, which I wish I would have. But definitely chemical peels and good skincare at home are like safe to try. Definitely like 4 to 6 months before your wedding, just in case you did have some sort of odd reaction to it. You don't want to do anything too close to your wedding, but they really make a big difference. I've helped a lot of brides get their like dream skin.
Oh, you got something to look forward to.
Fancy.
Very forward to. Can you do them while you're pregnant? Or no?
So that's definitely talk to your doctor. Typically, high levels of acids are frowned upon while you're pregnant. But again, I always recommend talk to your OB because every doctor has different opinions about it. Like my sister, her doctor, had her change her whole skincare routine. But others are like, no, you can keep everything except the retinol. So it really just depends on your doctor and what they want for you.
Interesting. The retinol thing is really interesting.
Yeah, it's never been brought up in discussion, my skincare routine with my doctor. They said I could eat sushi and lunch meats as long as it's not gas station stuff. Like, it's just funny. I think a lot of things, change and have evolved, and everyone has their thoughts and opinions on a lot of it too. But so noted.
And same kind of deal when it comes to anything aesthetics, and that's why it's so hard to keep up with. How, like, any tips and tricks of how do you keep up with such a fast moving and fast evolving field?
Yeah, everything that I've learned is not on TikTok.
Yeah, to be honest, stay away.
I'm so happy for that.
I have so many clients that are like, I got this product on TikTok or whatever. Like, TikTok is amazing. I love TikTok. I've learned a lot, like sourdough things, and it's fun.
Yes.
But at the end of the day, like, it's marketing.
Yeah.
So on TikTok, they're using influencers to market their products and their ideas and their specific med spa or things like that. So it is important to really weed through that to understand, okay, what's the good, what's the bad. Yeah.
Are there any, leave us with any takeaways of any sort of things that you hear out there that you want to debunk and put an end to, or something that we should just be conscious of moving forward?
Yes, so I get this a lot, and even my mom has done this. So it's microneedling with RF. So RF is radio frequency.
Okay.
Now we use it in our M-tone to help diminish fat, as well as our neo. So it decreases fat. So when you're putting microneedling with RF on your face, it can diminish fat cells on your face. So typically in a face, we want the fat on our face because that's
Right.
going to keep us young and youthful and plump. So if you're doing microneedling with RF, I don't want to name drop any different types of names, but Skin Pin is one that we offer that doesn't have RF. So you're not at risk for diminishing those fat pads in your face that you want. So that is like the biggest myth that I have clients doing all the time. They're like, oh, I had microneedling with RF. Like, okay, like,
And you're like,
now you're getting a
yikes.
bunch of filler to replace the fat you've lost in your face.
Wow.
I think that that's what's so kind of scary about people when they're starting this sort of aesthetics journey is, you know, you don't want to do something that you then later end up having to correct. So that's really nerve-wracking, but that's why, you guys, it's so important to end up sitting down, having a consultation, chatting with somebody who is super knowledgeable like Alex, and getting all of that information before you start, because I know this was insanely informative and super, super exciting for us.
This was amazing.
Yes.
I think it, like, there were so many moments I was like almost speechless because I was like, this is not as simple as I thought it was in my head.
And mind-blowing. Absolutely.
Very informative. So thank you so much for interviewing with us.
You're welcome.
Thank you so much.
And thank you so much for having me on the podcast. And follow me on AlexRN_SkinB on Instagram. And I'm on TikTok.
Awesome. Thanks, Alex.